the Common Pantry here. So first of all, my name is Luis Marrero. I'm the chair of the Health Committee. Thank you for being here today, and Happy New Year to everyone.
Happy New
Hoping
Year.
that this year is better than the year before. And today we have some guests that are going to be presenting to our health committee. And following just the agenda, the first person that we have, or the first organizations that we have, is the New York Common Pantry, and they're going to be updating us about what's going on and what they're proposing. And we have Helen Miller and Stephen. What is Stephen last name?
Grimaldi.
Grimaldi, yes.
Romaldi.
And it's Ellen with an E, Mr. Chair. Ellen
Okay.
Miller with an E.
All right. Thank you.
So,
So
Mr.
the
Chair,
floor is yours.
if I can just have a point of reference, Mr. Chair,
Sure.
I'm sorry.
Go ahead.
So, Councilmember Salamanca has sent me an email a while back regarding Common Pantry moving into our district. They're going to be located, or they're looking to get a warehouse in Oak Point Avenue at the back in the industrial zone.
Mhm.
And I guess I can speak on behalf of the council member. He wants to be supportive to Common Pantry, and kindly asked them to meet with us to give us an idea of what they're doing and what they're looking to do at their new location in Oak Point Avenue. So
Okay.
I've been following up with Mr. Grimaldi at first, and then Ellen Miller, who's been very diligent in following up with us, and very exciting now to have them here. And I need to follow back up with the council member with what transpires tonight. So
Oh,
I want to be transparent with that, and I just needed that point of
yeah.
reference. Thank you so much,
Th-
Chair.
Thank you, Ralph. I just want to add, my other job, some people will know, is Urban Health Plan. We have been working with New York Common Pantry for a very long time after COVID hit, and we don't complain. Our patients were very happy. So we used to do it every month, um, in the Philip Dreams Park. Then when it used to get cold, we spoke to the council member, Salamanca, and we were able to do it during the cold months in his office. So we're really happy having Common Pantry here talking to us.
That's
So I
great.
can talk on behalf.
That's great. So, Mr. Grimaldi, good evening, and I guess that's a very warm introduction and welcome already. So,
Well, thank you. It is good to be appreciated. Can you hear me,
yes, we hear
everyone?
you loud and clear, sir. Loud and
Oh,
clear.
perfect. So I also want to thank Ellen for pulling this all together. You mentioned she's diligent. I also want to mention that Judy Seacon, our Deputy Executive Director, is here. I don't know if Demetrius Komodromos is with us, but he is our architect. And also I see Dina Murtha, who's our Senior Director of Development and Communication. So we've got a team here. If anyone has questions and I can't answer them, we certainly have our brain trust here. They're absolutely amazing. So what I want to do today is just walk you through, tell you a little bit about what we do. It sounds like a lot of folks know about us. I'm going to try to go through some of this quickly and tell you why we're talking today. I do just a 1 mile point of correction. That is, we're already in Hunts Point. We have an 8,500 square feet warehouse in Hunts Point in CB2 and have been there for many years through a program we call Nourish. It's a senior commodities program. It is just not big enough to serve all the people that we need to serve. So we're looking to expand that, and I'll tell you more about that. So if we can go to the next slide. Great. So there's something in my screen, so let me try to move it. There it is. So as you know, food insecurity is on the rise during the pandemic, and we have continued to meet the needs of the food insecure, including in the Bronx. And as I mentioned, the 8,500 feet square feet warehouse is not enough. So we've secured a new warehouse space on 1285 Oak Point Avenue to long-term rental. It does need major renovations, and those renovation costs have gone up significantly since we first looked at the facility. During this time, we have worked with our board and with some of our partners to think more deeply about possibly purchasing the facility. It's still an option. We are becoming more and more interested in that option because of the cost of renovating it. We certainly don't want to renovate a facility and then walk away from it. So we're looking at that possibility. So one of the things I'd like to walk away with today is an understanding from the community board if you support that particular option. It has been vacant for some time. I'll tell you more about it shortly. So next slide, please. We're one of the largest emergency food providers, almost 8 million meals last year. We're on pace to serve 9 million this year. That's an increase of 16.5%. I want to point out that 16.5% on top of 28% increase last fiscal year. It's just it's an enormous increase for us, and obviously COVID has really impacted the people that we serve and has added to the numbers that we've served. 13 million pounds since COVID-19 hit. Big increases there. We provide holistic services. I'll tell you more about that in a second. And one thing that's interesting about our pantry is that we provide wraparound services. So the average pantry membership or member is active for about 2 years. After about 1 year, they start to reduce their reliance on us. They come less often. We've done some wraparounds sort of surveys and to figure out why. There's a variety of reasons. One of those reasons is because people get stabilized with other resources, SNAP benefits, for example, other things. They don't need to continue to come to make coming to a pantry a full-time job. That's our goal, self-sufficiency. We know that's not always possible. So if people need to come to us long-term, we are there. We are not putting caps on that, but we do our best to try to get people as self-sufficient as possible, or at least not to need our services. Next slide, please. So we have food programs. This is a mobile pantry, hot meals. We do brown bags. Some of those are 109th Street location in East Harlem, but our mobile pantry program, our Nourish service site, our pantry at Hoe Avenue, also in the Bronx. So we have Bronx locations in our food programs as well as Manhattan ones. Next slide, please. I'm going to go quickly so we can get to the questions if you have any. Health 365 is our program that's part of the wraparound I mentioned. Helps people with resources, SSI, SNAP benefit, legal services. So we do a lot of that to help leave no dollar on the table for any of the people that we serve. So we screen you, you come in, we find out what you're eligible for, we connect you to those resources. Next slide. Live Healthy is our nutrition education program, so we're not interested in just filling bellies with empty calories. We know that there's a lot of food-related chronic diseases. We want to help you access nutrient-dense food that's affordable and seasonable, sustainably sourced and culturally relevant. We promote healthy lifestyle choices. We do health screenings. We work with hospital and medical centers. We have farm-to-community partnerships. So one of the programs, the Food MD, is a doctor will write a food prescription. We do that at Mount Sinai, Ryan Health, Borinquen, in Manhattan, to be able to make that connection for people. Because once they see the food that we provide and once they make that connection, we connect the dots and get them into the food. So that's our Live Healthy program. Next slide. Our Nourish site you may be familiar with. This is an enormous program. We're based. That's where the warehouse is in Hunts Point, 420 Hunts Point Avenue. This is the program that serves seniors. We have over 100 locations throughout the city, many of them in the Bronx, that we serve low-income seniors by providing these supplemental packages. You have to be SNAP eligible for them and 60 years old, as well as meeting income requirements. It's an enormous amount of food, 23 meals per food package, and you can access that once a month. That's our Nourish program. We also have a service center in the Bronx at 138th Street. This service center we'll talk about shortly because it's one of the two facilities that we're looking to move to Community Board 2. Next. Excuse me. Project Dignity is at our 109th Street location. It is services for the homeless. Showers, haircuts, laundry, state IDs, mail service. We help people get housing, supportive housing, filling out the New York applications, and we have a psychiatrist. We do telehealth as well. So we do some homeless services, but again, we base that out of our 109th Street location in Harlem. We take people walk-ins all the time. Next slide. I know, no surprise to those of you today that the Bronx is considered the city's most food insecure borough. 1 in 5 experience food insecurity, 23%, more than 20% of older residents. And so we're really focused on it. It's one of the reasons why in 2017, we were seeing so many people for the last, really since the late 90s, come to our East Harlem location on 109th Street from the Bronx. Because they were taking the 6 and on the 2 or the 3, and we decided we're going to open a pantry in the Bronx. So we have one at 1290 Hoe Avenue in a Banana Kelly facility, and another on 138th Street for our Nourish program. So those are two reasons why we moved, because the amount of food insecurity is so high in the Bronx. And it was basically a second job. It was like people having to come all the way to Manhattan to get their food to go back. Now, of course, there are many food pantries in the city, but oftentimes people have to go to multiple, and sometimes people wanted other services, as well as a lot of the food that we were hearing, the feedback we were getting is that the fresh food that we provide was relatively unique. So that's one of the reasons why we saw an increase in spike in demand. Next slide. Okay, the next couple of slides will just tell you a little bit about the meals that we've served since the pandemic began in March of 2020. What you're going to see is here are 40, as you're going to see, over 5 million meals served, hundreds of thousands of visitors. And you can see here, not only are we focusing on the Bronx in these next couple of slides, but Community Board 2, visitors by zip code. So these folks come. While 1290 Hoe Avenue is outside of CB2, it's on the edge, and many folks do come to our location from the community board. Next slide. Our Nourish program sites, we served 2 million meals since the pandemic began to 91,000 visitors, another 82,000 visitors, and 1.2 million meals for our mobile pantry. I want to mention the mobile pantry is one of the biggest reasons and the biggest spikes in demand, because as we partner with more sites, including in the Bronx, as well as one-time ongoing distributions, 20 and 114 one-time distributions, we're seeing more and more demand for this food. Some of you, I heard someone from Urban Health Plan talk about, that's exactly the sort of sites that we have partnered with to do this work. And we need more space. We're actually converted our location at 109th Street in Manhattan, the lower level, where we used to serve participants who would come into the facility. We're now serving them outside, and we're using that as our warehouse. That's not sustainable. We have to have people back in the building so we can serve. So that's why in our 8,500 square feet facility in Hunts Point currently is just not big enough. It cannot handle the demand and the sheer volume. Okay, next slide, please. So these are our sites in CB2. You'll see that we have 5 home sites. Please don't be deceived by this. We have 5 home sites here. We're actually we have 2 that we've rented, 788 Southern Boulevard and then 1285 Oak Point. Those are the ones that we're going to be renovating, and we'll be moving out of 423 East to 138th Street, which again is not in CB2. We'll be moving out of that facility. And then the Hunts Point Avenue warehouse at 420, we're going to be closing that up, ending our lease, and then moving to 1285 Oak Point Avenue. You'll also see 7 mobile pantry sites here, 4 Health 365, again, that's benefits access, and a Nourish senior distribution site at El Nuevo San Juan Church, right next to the council member's office. Next slide. Some more CB2 data here, just the number of visitors, 4,500 visitors in our mobile pantry site. And, you can see thousands and thousands of meals. Our Nourish locations, not as big as they were before the pandemic, number served, but we hope that will go back up. And again, our Health 365 teams were at these locations: South Bronx, Morrisania, Banana Kelly, Urban Health, and El Nuevo San Juan. Next slide. Sorry if I'm going so fast. Slow me down if you need me to stop at any point. I'm just trying to make sure I don't.
Okay, Mr. Grenard.
Okay, I'm not trying to take too much time from anyone else. So.
No. We good. We have enough time. I just want to make
Okay,
sure that everyone, please put your information in the chat so we can document that you was here. I'm sorry. Go ahead. Continue.
no worries. Another thing that we work really hard to do is hire folks who are going to work in the communities that we serve. So this data is here to show you that 44% of our workforce live in the Bronx, 47% of our workforce work in the Bronx, and that number will go up as we move, as we grow our facility, as we get bigger, as we renovate, as we move more programs into the community board, into the site at 1285, as well as 788 Southern Boulevard, which I'll talk about shortly. So 58 positions are planned for the community board as well. So we'll have folks, many of those, the vast majority of those people rely on public transportation to come. Next slide. So with the demand in services in the Bronx, we are expanding. We're operating a warehouse, as I mentioned now. It's no longer adequate. We've rented space at 1285. We have a 10-year lease with the option to increase for additional 5-year periods. We do need to renovate the facility. It's basically an empty shell. So I mentioned our mobile pantry program. We want to move that program from the basement on 109th Street there. We are going to expand our Nourish and our food program, food hub space, or the food hub is what we're going to call it, to allow us to centralize the location so we can receive food, store food, and then get the food out to the communities that we serve. We also will be adding more program office space upstairs at 1285 Oak Point Avenue. It's about 3,000 square feet of the 23,000. So roughly that breaks down to 3,000 office space, 20,000 of warehouse space at the 1285 Oak Point Avenue location. So that is the biggest expansion. And as I mentioned, to renovate that space, the cost went up so significantly in the last, because of supply chain issues and other costs, that we went back to the drawing board. We've done a lot of value engineering, but we do believe that the space, to do it right, to provide a livable space for our staff, or a workable space for our staff with clean office space and conference room, as well as really good economies of scale, ability to do what we want to do, that we're going to need to put in significant resources into that facility. In addition, we're opening a new service space. I mentioned 138th Street location. We want to move. It's not an ideal location. It's on the second floor. We want to move the space to 788 Southern Boulevard. We've rented that space. There is a train nearby. There is obviously bus line right there, and it's on the ground floor. So it will allow us to have a bigger pantry area. So that's 788 Southern Boulevard. Next slide, please. So now we're going to get into the construction project summary. The two sites in question are pictured here. The first is 1285 Oak Point. That's the one in the middle to the left. And the second is 788 Southern Boulevard. If you go underneath the image for 1285, in the middle there, you'll see the just a picture of what that space would look like, being able to store food, have the trucks come in, pack them up, and then distribute the food. On 788 Southern Boulevard, that's a place where service location, that would be the service area where people would come in, be able to, because they're part of the Nourish grocery package program, they're seniors, they would get their food packages through an opening in the wall. Behind that wall would be a packing area. The packing area that we have right now at our facility is so small and just not very practical. So this is going to be fantastic. It's going to be a nicer area for people that are waiting, especially the seniors, and a bigger area for people to pack the food, and then a service window where we can serve them. Right now, we have to come all the way to the corner and come into the room, pack the food, and then go back out into the waiting area. It's not convenient for anyone. So we're really looking forward to that. Next location. I'm sorry, next slide. I mentioned that the first early renovation drawings and projections were around 3 million, as subsequent 4.5 million. So I'm being very transparent here. This is one of the reasons why we're looking to purchase this building. It is, while it could be roughly rent equivalent, and it just doesn't make sense to put all that money into a facility and then walk away from all of those renovations and then hand it back to the landlord. So we're sort of thinking deeply about that process. In order to do that, we want to be able to renovate and then have that facility so we can continue to upgrade it. Next slide. A lot of text here, sorry about that, but this is really meant to give you some much more information to do a deep dive about the 1285 Oak Point Avenue. Obviously, you know, many of you know that it's because of Hunts Point where it is, it's not off the subway line necessarily, or there's a 12-minute walk, but it is off the BX46 bus line. And it's very close to the 788 Southern Boulevard, which allow us to get food into that location quite easily. It allows us to have shared economies with our Nourish program. That's our senior program again, the mobile pantry program, and the food programs at our fixed pantries, including 1290 Hoe Avenue, which again serves you know, over 1 million meals a year, on pace to serve well over that this year. Contractor Imian Partners, after much bidding, going back into the bidding process, have agreed to work with them, or in the contract writing process now. They've agreed. We've asked them to solicit subcontractors from the community board. We believe that that process will be underway. I hope we can start construction before spring begins, and then we estimate it'll take 6 or 7 months. And again, that project alone will cost around $3 million to the organization, but we do believe that it will be perfect for our needs at the end of that process. Before I leave this slide, I just want to mention that as part of our agreement with the landlord, we built into the lease process, into the rental process, the ability to purchase this facility. We negotiated that long and hard. We weren't sure whether we were going to be able to do it or not. Once we saw these increased costs, we decided that we're going to look much more deeply into that, as I've mentioned a couple of times already. So it's one of the reasons why we believe that we can do it, because what we negotiated with the landlord seems to be at market or below market, which is fantastic. Otherwise, we just wouldn't be able to afford it. We are going to go to the city and ask them for support to be able to provide some money, working with the council member through that process. He has said that he would be interested in helping us do that. So we're delighted if that is the case, if we can make that happen. Next slide. These are just, again, the visual highlights of the space. If you look at the space on the right, you'll see that the one to the right is our food programs. That's closer to Coster Street. And on the Fail Street side is our Nourish program. That program serves seniors. Next slide. And this is just a summary of the 788 Southern Boulevard site. Again, this is the service location for seniors for the Nourish program. Next slide. And the visual highlights of that facility. Again, we love this facility. We love this layout. We've worked really hard because it'll really be senior focused, senior centered. It allows people to come in off the street, take a ramp, sit right down in the waiting area and get served. And then on the other side, the offices are on the other side, so the seniors don't have a long way to walk. It's not where we have it currently situated is not ideal. So we're really looking forward to this space because we believe it'll serve the community really, really well. Serves you know, thousands of seniors a month will utilize this particular site. I mentioned this program serves mobile sites. We have a lot of sites, over 100 that we serve. this particular one, because it's a fixed site, is the most active site. It is a site where most seniors will come, and because it's such a great location between bus routes and subway routes, it's ideal for serving sites. And again, very close to the Oak Point warehouse, the food hub. Next slide. All right. I think I did it on time. Thank you for your patience. So please, if any questions or comments.
Well, thank you, Stephen. I mean, I'm really surprised everything I saw. I can tell you, I remember when you guys came in like few years ago, started working with Urban Health Plan, and I see the growth, which is great, especially in our community, community board too, where there was an article in the National Geographic identifying Hunts Point as one. I think it was said, if I remember, it was the biggest or the number one location with food insecurity. So you're coming to the right place. I believe the support of Councilmember Salamanca is great, and he's so pro our community. So I really thank you for what you showed to us. Thank you for coming to the community board. Let us know what you guys are doing. We have so many community-based organizations. We have that I know that they're going to be help. Linking with you guys can provide better, more services to their clients. I don't know if anyone has any question.
Yes, Louis. Julia has her hand raised. So, Mr. Grinaldi, Julia Cruz operates out of St. Vincent de Paul. It's a recent senior home, and she's the first vice chair of our community board. Julia?
Hi, gentlemen. Thank you, Mr. Grimaldi, for coming to the community board, to our health meeting, and sharing your ideas. As Ralph mentioned, we newly opened up the senior building. It's 88 seniors, 62 and over. 26 of them came from the shelter. So I interviewed them before they came in. So they still have that, I don't want to say it, but the shelter mentality that, I'll take whatever's given to me. So I want to get them out of that. They do have difficulty in getting foods and resources because they're so guarded. So I'm able to secure some food for them, but unfortunately, what I've done is amongst us, the employees at the nursing home, we gather food for them, so that way they don't have to walk the streets and find food. So if I can get something more secure for them, so that they don't feel like that shelter that they were in, because they were there for a while, and plus they're seniors. So I want them to feel secure. So if there's anything we can do together with you so that we can make them more secure. The 26 mostly, but others in the building are also alone and having their difficulties. So if there's anything you can do to, work with me to help them.
Well, absolutely. So this is a senior building where people have their own apartments and their own cooking facilities?
That's correct, yes, yes.
Okay, and how many units in the facility?
88.
88. I'm sorry you said that already. I apologize.
No, that's okay. That's okay. I talk fast sometimes.
No, I didn't write that part down. Sorry. Well, we'll reach out to you because we have we have the ability to expand either our Nourish program to make it a location, or we can find a site that's close by where they can come by. Sometimes we look to set up a site, but there's a site right around the corner that's very convenient, and oftentimes people don't know about it. So my email, should I put my email in the chat?
I can share it with her.
Okay.
The building that she's located at is literally, 2 blocks away from your 788 7 Boulevard location.
Right. We're at between. We're right there by Beck Street and 163rd, close to 163rd. So it's within walking distance. So that would be fantastic.
Okay, so we have started already, even though we're not in that facility, we haven't started renovating yet. We have started to make it a mobile site. So as a result, we do already serve there. And Judy, you want to, Judy's here, she can tell you a little bit more about that location.
So is your email jcruz@archcare.org?
Archcare.org. Yes, that's
Okay,
me.
so I'll reach back out to you, but we have started serving. We serve once a month at 788 out of the there's a health facility next door. So while until we're set up, we're working with them. We also do serve other places in the area. So I'll email you tomorrow and we can figure out what we can do with you.
Perfect. I appreciate it. Thank you, guys. Thank you. And thank you for all you do.
Welcome. Thank you. All you do.
Mr. Chair, we got Raymond Arroyo with his hand next.
Right.
Hi, Mr. Grimaldi. Could you expand a little more on the positions that are going to be opening up? Are these volunteer? Are these paid positions, and the types of jobs? Or
Sure. Absolutely. Judy, you want to cover that?
Sure. So we will be bringing our mobile pantry there, and our mobile pantry will have an assistant manager position, a food programs associate position. So these will all be paid positions. They'll be full-time positions. We'll have a driver position, and we will have a commodities associate position. So they're warehouse positions for food programs. We'll also most likely be looking for a receptionist and some other administrative positions, an operations director in the future, as well as some more commodities and drivers. So while we right now have budgeted for an additional 11 positions that are coming, as this building opens up and as we put more of our programming in there, that will keep growing.
that's quite a bit. Thank you.
You're welcome.
Thank you. Who else, Ralph?
Jennifer Kelman, Mr. Chair.
Jennifer.
Hi, everyone. Happy New Year. Mr. Grimaldi, I operate a social daycare in the community board. We're on Westchester and East 161st Street. I also work with seniors, and I would definitely love to, work with you and reach out maybe tomorrow and see if we, how we can work together. Because a lot of our seniors also, have a lot of food insecurities, and they don't want to come out of the house right now with COVID and it's cold. So
Absolutely. Reach out. You can reach out to myself, or you can reach out to Judy Seacon, either one of us.
okay, so I'm gonna give you guys a call tomorrow. Just wanted to introduce myself so you know who's calling.
Nice to meet you.
Okay, thank you.
Thank
Jennifer,
you for your
can
help.
also send me an email and I can forward it if anything, okay?
Okay, thank you.
Thank you, Jennifer. And anybody else, Ralph?
Mr. Chair, I don't see no more hand raised.
So I really appreciate coming you to do this presentation at community board. I think this is good. I've been willing to hear good news, and this is a good news. So that's great. Thank you very much for coming in. There is a possibility that I may invite you, because there is another coalition. There's a Hunts Point Longwood Coalition, and it's composed of about 20-something community-based organization from Hunts Point, and 10459, some 10459, but mostly are in that area. So it will be great if you can come and do a presentation there. They will really appreciate it.
Great. No problem. You let us know what you need. Thank you
I
so
will.
much. We appreciate all the work that everyone on this committee does, because we all know we're all fighting the same fight, doing different things to do it. But thank you all for all your work.
Ralph, what are you gonna say?
Mr. Grimaldi, next on your facility at Oak Point, when are you looking to actually open that up?
So we believe if we can start in February and get done in 6 or 7 months, like they're saying, that would be September.
Okay. Well, a couple of things. Urban Health Plan also has a workforce development. So regarding the hiring, if you need to, you can send me some information. I can forward it along and make the contact there. If you're looking to do some local hiring,
Absolutely.
Encourage local hiring. We're a community that believes in a walk to work, and we have plenty of positions because we're an industrial business zone. You're actually located in the IBZ, so we can also moving ahead when you're ready for that. You can always reach out to me. and some of your neighbors, in particular, you're diagonally across the street from F&F Supply. So Gary Jacobs is a friend of the board also, but there's other neighbors, I'm sure, at Oak Point. We can make some introductions, and if you're having any issues, you can always reach out. And I will follow up also with the council member, just making them aware that you guys did present, and I guess this committee, feels the need and the support from you guys, and I'll follow up with the council member with that. So thank you so much.
Thank you.
Thank you.
We appreciate it.
All right, so moving along in the agenda, you may go if you want. If you want to stay with us, you're more than welcome to stay with us.
I can stay for 10 more minutes. I'll do that. Thank you.
Sure. Do we have the person from Children's Aid Society?
Yes, I'm
Okay.
here.
Okay, so we have a presentation, Nyasia. How do you spell your name?
Nyasia.
Nyasia. Okay, Nyasia from Children's Aid, and come to do a presentation to to report some updates. Welcome, Nyasia. How are you?
I'm doing really well. Happy New Year's, everyone.
Likewise.
Am I able to share my screen?
Ralph.
No, but I have two presentations that you gave us.
Oh,
One for November,
okay.
one for December. So I'll put up the November one first. Is that okay?
Yeah. I want to. Well, you don't have to put it up now. But I wanted to talk a little bit about what we're doing at Bronx Impact. And kind of what the website that we pull this data from is, and kind of what it means. So before I jump into this data report about like what Bronx Impact is, and so that BronxImpact.org is part of a larger initiative called Bronx Impact that works on addressing systemic inequalities across the Bronx through place-based resident informed strategies. We were formerly a part of Poverty Reduction Initiative, but that grant is no longer here. But we still as an initiative with other organizations. If you want to know a little bit more about the other Bronx Impact, you can just go ahead to our impact.org. But what I specifically on is my.bronximpact.org is a online resource that free or reduced care, food, housing, and what we do is our site is free to use for people who are looking for supports and services, and also for community-based organizations who are looking to advertise their supports to Bronx residents, as well as respond to referrals that they receive through our site. So if you have ever used ZocDoc or Yelp, it's basically like those sites, but for social services. So you can make an appointment directly through our site to that specific program. And the reason we do it this way, program first, is because it's really hard to navigate the system. And we know unless you're super tuned into the community, it's really hard to figure out what services are around you, even if it's, around the block. And so we list all of our services by program first, because, no Bronx resident is going to be like, I want a children's aid program. They're just going to be like, I want childcare. And so we want to lead them directly to a specific program where they can get the services that they need. So people can go on our site, they can put in their zip code, and then you can browse for whatever services. you can connect directly through our site. We have over 3,000 programs that serve any Bronx uh, uh, and that
Naisha, I'm not sure if it's happening to everybody,
local
but
so people
you're getting cut off.
go if they need to Bronx Impact just because of uh, uh, organized um, approach and support and partner with. So,
can you hear me, Naisha?
Oh, got my video.
Hello?
Oh, yes. Oh, did I
Naisha,
cut off?
can you hear me?
I can hear you. Can you hear me?
Yeah, well, you've been like coming on and going, so your thoughts are not really like
Oh,
full sentences.
oh no. Okay, sorry. I just turned my camera off, so hopefully that makes it a little better.
Okay.
Is this okay for everyone now?
Yeah, now it is better.
Oh, okay. Oh no, I don't know how much was cut off. But if you were able to hear it, we basically are a Yelp or a ZocDoc for social services. Um, and so as you can imagine, once COVID started, lots of businesses were closing down and people didn't really know where to go to receive services. So we actually have seen a huge jump in activity on our site since COVID started. We've had over 11,000 users on our site and over 20,000 searches. And we've been able to connect directly through our site over 1,100 people to a service through our site. So we're super excited about the work we've been able to do so far. So what you're seeing right now is a November data report specifically for your community district. On our site, we have a bunch of different categories that people can search by. But the three most popular categories or the three searches that have been happening in your district in November 2021, I can't actually see this super clearly. November 2021.
I also got December's.
Yeah. Okay, great. Yeah, I'll move on to December's right after this. But the three most the three search categories in your community districts were health, food, and goods. And you can see there was a big percentage of about 43% of residents that were on our site were searching for help with health related services. That could be anything from counseling to health insurance. If you look at the most common search terms in your district, on the bottom of the page, it'll show you a little highlight of what in that specific category people were looking for. If you look at goods, that obviously focusing a lot on, Christmas is coming up. So a lot of people doing searches for toys and gifts. And then we have food, which was around 29% of the searches in November were around food pantries, emergency foods, and services like that. We had in November 99 residents in community board who used MBI, and that was around 133 searches that occurred in that month from those 99 users. And then you can see the most popular zip codes, and at that time in November, only one zip code was where all of these searches happened. So that's kind of what that data you're looking at means. You can go over to December. And in December, we see we've had 174 Bronx residents and community board 2 using the site. 50% of those searches, again, were really focused on health-related services, and that totaled to 327 searches that occurred between those 174 residents. There's also 17% residents looking for care, 17% for food, and 8% that were looking for transit-related services. Again, these are all categories that people can choose from on our site. And you can see the popular zip codes have also changed. We've been working a lot more closely with the HOPE program. So that's why you see a little bit of a jump in the number of residents using the site and the number of searches happening. So around health, you see that there's a lot of searches for in-home supports, medical cares, reproductive health, a lot of Alcohol Anonymous related programs that people are looking for. And again, you see emergency food and food delivery as another major search on our site. So that is what the data reports mean. We send these out once a month to every community board. We also work with other community-based organizations and support them with addressing the needs in the communities that they're serving and where they could be focusing on in terms of expansion, etc.
Yeah, Naisha, I think this is a good information just for us to understand what our community is looking for. But my question is the following: how do they do the search? That was in the beginning of your presentation and I was missing it. How do you access it through an app? Do you go to
yes.
Twitter?
So
How
if
do you do it?
So if you go to my.bronximpact.org, you can go onto our site. You can put in your zip code. It will show you a bunch of categories that you can try and pick from. We also have it translatable into over 100 languages. So you can, type in any zip code in the country, actually. And if you're looking for food, I think it goes from food, housing, legal services, goods, money related services, transit. You can pick any from one of those categories, and you can find a program that will help you, pay for housing, help you find housing, etc.
Okay, so if people wants to find it, you just have to type in the website mybronximpact.org, and then all that will come out, and they will fill out the information.
Yeah, it's really easy to navigate. They can is it possible to share that website on the screen?
You can write it down in the chat.
Okay.
Yeah, once it's in the chat, tomorrow I'll send it out to everyone who was in this meeting. The entire web chat I send out the next day.
Okay, cool.
So everyone would
yeah. So if you type it in, you can kind of see how it works. It's really easy to navigate. Once you choose the service that you want, once you put in your zip code, actually, it'll show you the number of programs that we have on our site that serve that zip code. And those programs go all the way from nationwide programs down to local programs that serve that zip code.
How long have you been doing this kind of
we started before I was hired, and I started in 2015. Or sorry, no, I started in 2015 actually. Yeah. So yeah, that's right. we saw a major bump obviously during the start of COVID. So we've seen real site activity on our site since the start of COVID.
Okay. Thanks. Because I believe maybe more people may use it if they know about it. I didn't know
Yes.
about it. So thank you for coming and let us know about it.
Mr. Chair, can I have a point of reference here?
Yeah, sure.
So for the past 2 months or maybe 3 months, I've been getting emails regarding the Bronx Impact, and it's a link. You open it up, you type in the zip code, and it tells you the services that people are calling, specifically the Children's Aid Society.
Oh, that's good.
But it's a very useful link. Sitting down with Cynthia, we said, hey, let's just invite them to the committee so that at least the committee members and the public now knows about this. And hopefully they get more hits on their website, and hopefully it can bring more resources to the community.
Sure, I totally agree. That's why I think
Yeah.
this is a great presentation, a great idea. So they can keep expanding. The use, because if it's a really good use, more people should be using it, and maybe they're not using it because they don't know about it. So thank you for coming. I'm gonna later tell Ralph just to give me all your contact and Steven's contact, so I can invite you also to the Hunts Point Longwood Coalition that I believe is also in Hunts Point. It's good to keep expanding.
Louis, I'll
Okay.
send you their request for presentation forms later.
Okay, thank you.
Okay.
Thank you.
Yeah.
Thank you.
Yeah, so we're always looking to add organizations and programs to our site. So if you're interested in getting your program listed or your services listed on our site, feel free to email me. If you are interested in a training or learning more about how we partner with community-based organizations, please feel free to email me, and I'd love to have that conversation and figure out how we might be able to even edit these data reports to maybe suit your community board a little bit more. Right now, what you're seeing is like a high level, but we can actually zoom in on particular categories and provide data on those as well.
Right. Thank you. Thank you very much.
Thank you.
Anybody else has a question? Ralph?
Chair, I don't see no one with their hand raised.
So thank you very much, Asia. Sorry I know I'm misspelling your name, but Asia. Thank you.
Yeah, you're saying it right.
I did it right. Okay, good. So moving along in the agenda, we have the person from Vibrant Emotional Health. Yes.
Sorry, I was muted.
Oh, okay.
As we were
right?
working from home, I'm trying to keep everything, nice
Michelle?
and quiet. Yes, Michelle.
Okay,
Velas.
so we have Michelle Velas from Vibrant Emotional Health, and she's gonna provide a presentation informing us about the services that you offer, right?
Yes. Good evening,
Welcome.
everyone. Happy New Year. Thank you. Thank you so very much. It's a pleasure being here. So yes, so Vibrant is the whole organization. Family and youth peer support is just a department of this big place, right? I just want to call it place. So we are actually formally the Mental Health Association of New York City. We've been around for about, helping parents and families for about 50 years. So our department actually offers peer support to youth and families, right? So we have two locations. We have one in the Bronx in 975 Cali Street, and then we have the other one in Queens. But because everything is via telehealth now, we kind of like expanding. We have parents from Brooklyn, we have parents from Queens, but we mainly focus on the Bronx and the Queens community. So with that being said, we offer parenting classes that includes Circle of Security, which focuses on parents with children 0 to 5 years old. We also have the emotional wellness. This is focused on really the parents being able to identify their own emotions to be able to deal with their child, whether they have any kind of like special needs or anything like that, right? We are also trying to get another that is another one that is called Parenting Journey, which also focus on the parents' emotions and to be able to deal with, the general children as well. We offer support groups. Um, and like I said, emotional and behavioral difficulties. We help the parents find resources. That's really what we're here for, right? To share the resources, and this we can share them with the parents and help them with their needs as well. Um, and we also have youth advocates, which are the ones that deal with the teenagers and youth as well. We offer them, like I said, support groups. And I think that's about it that I have right now. I'm so sorry. I don't have like a big presentation, but
That's
I
okay.
like just to go straight to the.
So,
We're gonna also this flyer. We're gonna post this and blast this out to everyone on our social
Thank you.
media. But this was good that you presented tonight. I know that you had bumped into Cynthia before, so this is
Yes.
so thank you for coming back on, Michelle.
Yes, and we also, I want to add, I'm so sorry that we are bilingual. I also have my colleague on the line, Renee. He offers classes in, I'm so sorry, Renee, what's the language that you offer classes in as well?
Yeah, so we offer classes in English and French and Swahili to the different communities. For instance, we have some communities within the Bronx area and Queen area that speak French and Swahili. So anytime those classes are needed, I'm the one who facilitate in those programs.
okay. And I have a question. At these services, do you have to go to a place to get these services, or these are presentations and workshops that you can access, or going to anywhere or virtually?
So currently we are completely 100% via telehealth, virtual. The classes are being offered through Zoom. We are not accompanying any parents. Like usually, let's say when they need advocacy, right, we go with them to court. If it's housing, we'll come with them to housing and stuff. But right now, everything is being virtual due to the COVID situation, and I guess a lot of us aren't, right? Most of us are working from home, so
Right.
everything is being offered virtual. Yes.
And do you have any kind of calendar of these classes done on a monthly basis, or do you prepare them as you go, as they?
Yes. So the parenting journey, it's 15 weeks. It's once a week for about 2 hours. The emotional wellness, the same thing. That one is 12 weeks. I'm sorry, 12 weeks
Mhm.
for once a week, about 2 hours. So when we do prepare, what we do is when we create a flyer, like the one that I just shared with you guys. We create the parenting, we send the emails, we share with, with the community, and things like that. So like that, they will be aware of when a class will be starting. And if they have any parents that are interested, they can refer them to us. And then we'll just do an intake and, get the parent ready for the class with the information, the details information.
Thank you. The next time you have one of those flyers that or something coming up, please don't forget to let us know so we can help you out and and
Yes.
distribute and inform the community what's going on.
Absolutely.
Actually, I can share with Ralph or yourself. I'm actually starting a circle of security class in Spanish in another week and a half. So maybe that would be something that I could share with you guys, and maybe you could share with
Yes,
everyone
please.
else.
Yes,
Sure.
do that,
Yes.
please.
Thank
Um,
you.
so, Ralph, is anybody with a hand raised? No? Is anybody has a question?
Mr. Chair, I don't see no one with their hand raised.
All right. So thank you very much, Michelle, for coming in and share with us that good information about the services that you are providing, that the Vibrant Emotional Health is providing.
Thank you. Thank you. It was a
All right.
pleasure.
So moving along with the agenda, any new business? Any new business?
I have something real quick. I wanted to just tell you guys. In terms of the nursing home, it looks like we're having an outbreak again. Yeah, it's getting bad. I think I'm not sure about the numbers, but it looks like there's about 8 employees, and I'm gonna say about 10 of the residents. We're doing, we put the plan in place again of keeping them isolated, keeping them on one side of the hall. But anyway, I just want you guys to know that here comes the bumpy ride again. So just bear with me.
Oh, thank you, Julia. I just got a tweet from the governor, and it says that the rate, the infection rate is 22%. So
yeah, and keep in mind, we have all of us have our boosters, but
yeah.
a lot of people are coming down with it. We were the first ones to get boosted, but unfortunately, it's hitting everybody. So just pray and hope that we're not affected as we were last time. But just pray for them, okay?
Yeah, stay safe.
Thank you, Ben.
Is any other business? Announcements. Is anybody who has an announcement? No announcements?
Yeah, we got announcements. We always got.
Good. I knew there was something happening.
Yeah, there's always something going on. We just want to make people aware. Hold on, of the applications are in now for the peninsula. So they're accepting applications for building 1B. Right, it's like 100 and something apartments. I'm not sure, but it's on the Housing Connect website. All right, and then we also have the actual printout for it. So it gives down the actual breakdown of the income and what's eligible. You can go on to the Housing Connect website to see that it's in our district. And even though we don't have the flyer for it, we also have 980 Westchester that's open now. So these only open, I think, for 2 months in the Housing Connect website. So we have this one on Tiffany Street. The address is 720 Tiffany. And we also have 980 Westchester. 2 buildings in our district that have been in development, and they're actually open now in the Housing Connect. So those are the announcements that we have. Thank you, Mr. Chair.
Good, thank you, Ralph. And just on behalf of Urban Health Plan, Urban Health is doing vaccination for COVID from Monday through Saturday, from 9 to 5. If you're still looking for your booster or your first or second dose, you can go there, 1065 Southern Boulevard.
Louis, can I ask you something? Is it true that, all right, it's like, say you have COVID, you caught COVID last week, you have to wait a certain amount of time before you get your booster?
Yes. You have to.
How long? Do you know?
It all depends, because you don't know how long you're gonna have the virus. You could have it for 1 week, you could have it for 7 days, you could have it for 2 weeks. The last time I heard was 6 months, but I think that was
you have to basically wait because you have developed antibodies in your, what they call anticuerpos, and the antibodies are working already in your body. So while you have antibodies working against the virus, they suggest you don't get it. So it will all be when and for everybody it's different. Some people, the antibodies wear off in 3 months, some people in 6 months. So it would be from person to person is different, but the highest is 6 months and the least is like 3 months. So it would be, they would consider the antibodies in your body.
Right. The best bet is talk to your primary care provider.
Okay.
Yeah, they'll do lab work, and they'll see how much antibodies you have, and they can estimate more or less how much time you need.
Right. All right, that's perfect. That's good to know. Thank you so much.
Okay. Any other announcements?
I'm gonna bill you, Cynthia, for my medical advice. Bye.
All right. So moving along, adjournment.
I just want to say, I think we
Yes,
have
we have
3 good
the
presentations
council
tonight.
meeting on Thursday.
This has been really good. So,
Oh yeah. So I'm sorry. Who's Pascual? That was you.
Yes, I don't know if Roy is there, but the council, we have the precinct council meeting this Thursday.
Okay.
This Thursday?
Yes.
At what time?
At 6.
Okay.
Is it virtual?
Yeah, it's virtual.
Yeah,
I have the flyer. So tomorrow when I send out the web chat, I'll send out the flyer with that.
I texted to you too, Richard. I mean, Louis.
Okay,
Sorry.
thank you.
You should have it in your phone.
Yes, I should. So okay, so any other announcements? So we're gonna adjourn. A motion to adjourn. No motion. Do you want to stay?
Julia, make a motion.
I make a motion. I'm sorry, I was trying to get it off of mute. I make a motion. Yes. You want me
Thank
to
you.
second
We
and
still had 7 of your 8 members here, so great turnout.
Thank you. Thank you, Julia. So
Okay,
thank
you're
you,
welcome.
everybody. We'll see you in the
Stay
next
blessed.
meeting.
Stay safe.
Stay safe. Bye-bye.
Bye.
Thank you. Good night.